All right, good morning, afternoon, or evening, everyone, depending on where you are. Welcome to our webinar today, COVID-19, How Can I Protect Myself and Others, brought to you by the Smithsonian Science Education Center. A couple of quick notes before we get started about Zoom. First of all, you can direct any questions that you have to the Q&A box if you draw your cursor down to the bottom of your screen. You should see some controls there, including a question and answer section, and we'll address those in the question and answer portion at the end of the program. If you'd like to introduce yourself, you're welcome to do so in the chat box, which you can also find at the bottom of your screen. Just a quick note that this webinar will be recorded. It'll be available for reference on our website, and we'll also provide a written transcription that will assist with translation or supporting those who may be hard of hearing. So today we've got 5 things that we're going to work to cover. A quick overview of the Smithsonian Science for Global Goals project, and specifically the COVID-19 How Can I Protect Myself and Others module. And we'll have some insights from our friends at the World Health Organization, and then we'll walk through the highlights of the COVID-19 module. Finally, we'll give you some information about how you can get involved and where to find these resources. And we will conclude with the question and answer session. So without further ado, I would like to turn it over to my director, Dr. Carol O'Donnell of the Smithsonian Science Education Center. And then we'll work to get Carol's sound and video on here just a second.
Perfect. Thank you. Katherine, you can hear me okay?
Yeah, we can hear you.
All right. Hi, everyone. My name's Carol O'Donnell, and as Katherine noted, I'm the director of the Smithsonian Science Education Center, and we are one of many units within the Smithsonian. So the mission at the Smithsonian Science Education Center is to transform K-12 education, so education for students who are approximately ages 5 to 17. And we do that basically by looking at the view of education through science in collaboration with communities across the globe. And those communities are represented well in this webinar. Our role is to bridge formal and informal education. So basically bringing together the history, art, and culture and science of museums like those at the Smithsonian to students across the globe, either in their classrooms or today, many of them are learning in their homes. So the Smithsonian Science for Global Goals project is one of the projects of the Smithsonian Science Education Center. And the reason this project exists is because we were founded as a center by both the Smithsonian and the National Academy of Sciences in the US, the National Academy of Sciences, Engineering, and Medicine. And it is through that collaboration that the Smithsonian Science for Global Goals project was born. So this project basically addresses the socio-scientific issues of the UN Sustainable Development Goals. And those topics can range from mosquito-borne illnesses to food, to climate change, to biodiversity loss. And we approach this through what we call a community research lens. And that is that we're basically trying to bring students together with the scientists, engineers, mathematicians, public health specialists, or for other professionals across the globe to understand science, not only from their local place, from their local community, but also by being able to observe others. So these guides, these community research guides, are designed to be used by students who are ages 8 to 17. And those students can use these guides either in formal settings, for example, in schools, or they can use them in what we might call non-formal or informal settings, which is in learning centers, at home with their families, after school, summer school programs, and other programs that might take place outside of the formal school setting. The project is freely available. All of the content that we designed for both the teachers and the students can be found at our website. Smithsonian Science Education Center's website is www.ssec.si.edu. You can also find it at scienceeducation.smith.edu. www.si.edu. And this program is available in multiple languages. So what do young people do when they're engaged with the Smithsonian Science for Global Goals project? First, they engage with researchers from across the globe who are working on a specific sustainable development goal related issue or problem. They carry out local investigations on that problem using their community as their laboratory. So instead of traditionally engaging in learning the content just in the confines of their classroom, they use their local community as their laboratory to learn about that issue from a local perspective. They then examine the problem from a social perspective, an environmental one, an economic perspective, or an ethical lens. Our idea around doing this is that we engage students in social emotional learning so that they're not only understanding the scientific perspective of an issue, but they understand it from multiple perspectives so that they're making better decisions. And ultimately, what we want them to do is take the local action that they engage in their communities and understand that issue from a broader perspective. So moving from their individual identity to their local identity, community identity to their global identity. So how was the Smithsonian Science for Global Goals project developed and how was it created? So one of the things that we deeply believe in is in transdisciplinary learning, which is that you do not approach any one complex topic from a singular discipline, from a singular lens. And so as a result, we brought together multiple disciplines. And our belief is that this is not a multidisciplinary project. It's not an interdisciplinary project. It's a transdisciplinary project where the intersection of these disciplines together actually helps to transform that discipline just because of the presence of the other disciplines. So we've brought together inquiry-based science education, social emotional learning, socio-scientific issues education, global citizen education, place-based education, and education for sustainable development. This has been developed in partnership with scientists like those from the InterAcademy Partnership, which represents 140 countries across the globe, many of whom are represented on this call today. And these are the collaboration of national academies, sciences and engineering and medicine from across the world. Researchers and professionals and others who represent organizations like those that Marc is representing from the World Health Organization. So this is our theory of action. We call it the Global Goals Action Progression. And it basically outlines how students engage in the content with their educators. We believe deeply at the bottom of this pyramid that students come into a learning environment with a preconceived or an existing learning disposition. They are engaged in a local context, a local cultural context. And so it's important to keep that in mind as we educate our youth. And they also have certain scientific background knowledge when they enter the classroom. We then engage students in what we would call traditional inquiry-based science education, where we engage students in inquiry by asking them questions, drawing from them the questions that they might ask about the issue, and then helping them to investigate that issue in a hands-on, direct way. So they're engaging with the phenomenon as directly as possible, either by using their classroom or their community as their way of investigating. We then help them think about that issue from an internal perspective, so critically reasoning about it, from an external perspective by looking at it from a systems understanding view. And then we ask students to synthesize that information, to develop a management plan, and then to engage in action in their local community, to actually use their scientific knowledge to make a difference in their region. And the purpose of doing this is to build students' sustainability mindsets and to engage them in scientific inquiry. So what do students achieve by doing this? Our goal is to help students develop these sustainability mindsets. That is, that in order to understand the interconnections between their local and their global environment, that it's really important that students engage in agency, that they have a sense of the willingness to act, that they can actually make a difference by their own actions in their local community and actually make a difference globally. That we want them to see that science provides equity and justice, and that this allows students to engage in open-mindedness and self-reflection. So our perspective is that we're trying to do, and you've heard this from many people who do this, we're not the only people who engage in this work, but we're trying to create these global, local interconnections by giving students an opportunity to learn about a complex global issue, bring it down to a local level through local investigations, making local decisions, taking local action, so that they can understand that their local actions actually have global impact. We're creating this global learning environment because we believe deeply in the fact that it's important to combine STEM education, science, technology, engineering, and math learning with civic engagement, the engagement of local action taking by youth. So what guides currently exist within the Smithsonian Science for Education project? Currently available, our first guide, developed in collaboration with the InterAcademy Partnership, is called Mosquito: How Can We Ensure Health for All from Mosquito-Borne Diseases? Because over 1 million people die from malaria alone a year, it's really important that students understand the science behind mosquito-borne diseases and can make a difference in protecting themselves and others. The second guide that was released in December is called Food: How Can We Ensure Good Nutrition for All? We believe that students should approach nutrition from their understanding of food and how they access it, and how they can basically move from being in a food desert and engaging in food security. Coming soon, that we're working on currently under a project funded by the Gordon and Betty Moore Foundation, is biodiversity and sustainable cities. So where are we implementing this project? Many of the countries that are engaged as participants in this webinar represent many of these countries. But as you can see from our launch, which happened a year ago in January of 2019, we're now in over 12 different countries and growing quickly. And many of you as partners have helped us to ensure that youth all across the globe, no matter where they live, have access to this type of content. So can youth of all ages take action? We believe deeply that that is possible. Whether it's on a very localized scale, like the 6th graders on the left, who are kindergartners in Panama, who found and discovered that their community, as they defined it, was their local school grounds. And they recognized that the plastic trash on their school grounds were collecting standing water, and that it was in that collection of standing water, in that plastic trash, where they found many of the mosquito larvae. So they made the decision collectively that they were going to pick up this trash and to reduce standing water, and thereby reduce the larvae and the mosquitoes that were in their community school grounds. The high school students on the right, who are from Uganda, are working with our colleagues at the Marymount University, and they made the decision that in order to protect themselves in their community, they were going to build and engineer their own mosquito traps. And they tried different materials to attract the mosquitoes and then reduce their populations. The nurse in their region reported to us that she believed that the number of malaria cases from students had dropped. Whether there's a direct cause, we don't know, but the students were engaged in trying to solve the problem locally. So what's the impact? I mentioned to you that one of the goals is to develop students' empowerment and agency. And so we ask students questions at the beginning of the modules and at the end, whether or not, many questions, but one of those questions was, do you have confidence in your ability to change your local community in terms of your own local action? Can you cause change in your community? At the beginning of the module, as you can see here, many of our students in this particular survey believed they had very little ability to cause change in their local community. But by the time they were done with the module, they had a completely different sense of agency and empowerment. So what's our response to COVID-19? So about 10 weeks ago, we received a call from our dear friend, Dr. Sumya Swaminathan, who is the chief scientist at the World Health Organization, who's very aware of the Smithsonian Science for Global Goals project. And because of this problem, recognized that educating youth around COVID-19 and how they can protect themselves and others was an absolute perfect opportunity for us to begin to educate students around this issue. So we developed a rapid response community research guide called How Can I Protect Myself and Others? It's fully youth-facing, so we're writing directly to the students. It's shorter and more focused than our other modules because of its rapid response approach, and it can be implemented with these 7 lessons in about 14 days. We take students through a process from what we call Discover, in which they survey their communities and their others. Maybe it's their parents or their adult caregivers in their home. So we have them discover the issue by surveying others. We have them understand the issue by engaging in inquiry-based science to learn the underlying science of the issue. And then we have them act. We have them use that science to do social good, to make a difference. So we've engaged experts all throughout the world through the InterAcademy Partnership, through the World Health Organization, through the Smithsonian, and others. And these experts speak to the students directly throughout the entire module. So now I'm going to turn it over to our absolute dear friend and colleague, Marc Sprenger, who with his help, we were able to engage scientists from the World Health Organization, translate this module into 20+ languages, and make certain that the technical expertise was represented from WHO. So Marc?
Good afternoon, good morning. It's great to be a guest of Smithsonian family. Every time when I'm in Washington, I really look at these beautiful museum, and it's fantastic institution. Okay, next slide, please. So I think you have heard about the WHO and the response to COVID. It was all of the news recently. So in fact, we are focusing on 4 main issues. One is coordinating, speeding up research and development. That's of course very important if we are talking about a new vaccine, new drugs, or diagnostics. Also helping countries to prepare and to respond, to have the right procedures, the right things to do. We support these countries. And then coordinating the global response. The global response is what member states expect us to do. And we have just finished our assembly where we discussed with all the member states our global response. But the last one here, communicating about how people can protect themselves and others, is very, very important. And that's why we were very happy to engage with Smithsonian. So if you look again at what we are doing, we know that there is shortage of protective equipment. So WHO has all over the world warehouses where we store equipment, and that can be used by countries. That's one of the things that we do. The next is, next slide please, is that we help countries to build their capacity and to know what to do. So we have developed over 40 guidelines about what are the best diagnostic procedures, what about prevention and control of the disease. All these things are covered by a lot of guideline documents. Next slide, please. So the vaccine is one of the topics that are really discussed a lot, and we are all waiting for a vaccine. But it's really important to coordinate all the efforts, in particular if we are talking about trials. That's why we have set up the Solidarity Trial to support the development of new drugs, including vaccines. Next. Now, this is one of the things that we also have done. It's an open access WHO kind of academy. We offer a lot of courses, but these courses are for health professionals. So there is an intro course in COVID, health safety, prevention and control. And we see a lot of users, and we try to translate that in several languages. This is not easy, but it's important. Next slide. And that's why we are really very excited to support Smithsonian Science Education Center. It's exactly what Carol mentioned. There is a global response, but you need to act at a local level. And at the local level, behavior is important. Now, WHO would really like to invest in country impact. Country impact is for us the most important parameter. And then we are talking about behavior change. And the change drivers are in particular young people, children and youth. So we need to invest in the next generation. That's why our chief scientist called Carol and discuss how can we collaborate and how can we support you to develop this package. And from that perspective, Smithsonian Institute is a natural partner for us because you focus on youth education. Next. But we all know that to have the materials in English is nice, but it is not easy to use it all over the world. So we have started to support Smithsonian Institution to develop the content, but also in transferring this knowledge into the local language. And I just saw that there are participants from Kenya, from other African countries, from Philippines. I can assure you that we have translated the materials in Swahili, in Tagalog, in Hindi, in a lot of these languages. That's not easy because it is not only translate the words into a different language, it's also to adapt it to another cultural environment. So we have engaged over 40 volunteers, experts from WHO to really see how we can translate that. Now, we have succeeded now in almost 20 languages, and that's a big achievement. And we are grateful that Smithsonian is providing these materials at a country level. Now, the objective is ultimately to get a community ownership, that in a community, people are using this, but also can provide input for further development. So I would say it's a lively document, and we hope that in future new releases can be developed and more adapted at your situation. Thank you. Over to Brian.
Thank you so much, Marc, for giving us that overview of the WHO's efforts on this topic. I would now like to turn it over to Dr. Brian Mandell, who is the Division Director of Curriculum and Communications at the Smithsonian Science Education Center. Brian.
Thank you, Marc, once again, and thank you so much for the support of the WHO. I have the distinct pleasure of walking everybody through the key pieces to the COVID-19 module. I'm going to walk you through the framework. I'm going to walk you through each of the tasks at a very high level, and then some of the unique features of the module as well. And then we'll have a question and answer period at the end. So before I begin diving into each individual task of the module, I do have 4 key points that I want everyone to understand about this particular module and the experience that we have crafted. Number 1, we believe very much in learning by doing. This basically means that we're not just telling you, and specifically the youth, what the science is. We actually tried very hard to create experiences so youth can understand those things for themselves. 2, it is driven by youth questions. Every single question you will see in the module has been something that we have heard or seen or interacted with the youth, and that's something that they have asked on this really, really important topic. There are 7 tasks. It's supposed to be very, very manageable to undergo in a home or home environment with just a youth. 3, it is structured around the discover, understand, act sequence, which means we want youth to discover the science or social science for themselves. We want them to understand COVID-19 from multiple perspectives, and also multiple experiences and multiple experts as well. We have, as Carol mentioned earlier, we have interacted with a range of world-class scientists, which I will be talking about in a little bit. And finally, we want them to know what they can do about this themselves. It's all about agency, and we want them to act on their new knowledge and skills. And the 4th piece is, in addition to the science and social science that we have built into this module, we've also provided what we're calling physical and emotional safety tips, because we know that COVID-19 is impacting more than just our bodies, it's also impacting our minds as well. So with that being said, we can go to the next slide. And here is the storyline for the experience. And I'm going to walk you through each of the 7 tasks and highlight maybe an activity or 2 from each task, just to give you a little taste about what that experience is going to look like. The first task is, what is happening in the world right now? This first task is basically an introduction to the module itself. Students are creating an identity map to really understand what makes me me, and to think about, at a very deep level, how is COVID-19 actually affecting me? Then they actually engage in what we're calling it's a conversation strategy called a dyad. And it's a way to talk about challenging things like COVID-19 so that people feel respected and heard. And you do this on 2-minute intervals with you and a youth and an adult or caregiver. And you're basically listening to what they are really feeling about. And it's just a strategy that kind of helps you manage some of the emotions that might surface during this tricky time. Task 2 is all about how can keeping distance make us safer? And this is where we really start to explore what a respiratory droplet is. And we don't just tell you what a respiratory droplet is, we create an experience that students can see it for themselves, where we ask them to take a glass just like this, fill it up with hot air, just like this, blowing hot air into it, and then understanding how inside that glass it actually begins to feel wet. And those are products of respiratory droplets. And then they move forward a little bit more, and where they fill up a bowl just like this with some water, and they put their fingers into it, and they step maybe 1 step away from a wall, which is about a ½ meter, and just flick their fingers with the water in it to splash it on the wall. And what that is demonstrating, it's a model for what is happening with the respiratory droplets that come out of our mouths when we cough, when we sneeze, or when we breathe. And it's just a way for students, for youth, to understand how respiratory droplets spread and why it is important to keep that physical distancing. Task 3 is where we now build off of this new understanding about how respiratory droplets can travel, and we use something like a cloth to actually prevent them from spreading. Task 4 is really an elegant activity where youth are using water, cooking oil, butter, ghee, and soap. And they actually do a very, very simple activity that demonstrates how soap can destroy the virus by splitting that membrane. And again, this isn't where we're just telling you what the science is. We're creating an experience so students can understand it for themselves. Task 5 is all about how COVID-19 is impacting communities and our families. And this is where youth they actually have the opportunity to create a contact tree. And this explores how youth can think about all the number of interactions, the direct and indirect interactions they're having on a daily basis for them and their family. And then they can actually plan for it in their own home, and then understand what to do if somebody in your home actually gets sick. You know, what are the things that you could do to show that you care about that person? And there's also a really critical emotional safety tip within that task, where we let youth know that you shouldn't blame somebody who is actually sick. They're not, you know, it's just really important that they're not placing that blame on that person. Task 6, which is how can staying informed about the problem help? We felt like this is a really critical element to include, because in addition to this being a pandemic, there's also an infodemic that's occurring as well. And that is where we are bombarded, especially youth, every single day with information. And what we wanted to do was provide really clear steps so that they can learn to understand a little bit more about where that information is coming from and maybe what to do about it. And those four steps are for them to slow down, stop, and think about the information and the information that they're being presented with. 2, investigate the source. Think about where that information is coming from. The third step is for them to trace the claims or quotes that might be used in that source. And the fourth one is, depending on how that information is making you feel or what it's asking you to do, maybe find better coverage. And I think those 4 steps really can be summarized in one word. We want youth to evaluate the information they're being presented with. And that's a really, really critical piece to this. And the final task is, what actions can I take right now? And this is where we want youth to reflect on the overall experience of the journey. We want them to combine and think about what worked and what didn't work in their home or the local community, and then create an integrated action plan. What are the 2 or 3 pieces we want them to kind of fuse together, and what is the action plan that they're going to own and they're going to implement in their home? And then we want them to think through, how are they going to communicate their plan? And that is the overall story arc for the rapid response module on COVID-19. And again, here's just a highlight of some of the examples of what youth do. We're having them map their identities. We're having them survey people in their own home. And I think that's a really important piece. That's an ethnographic survey. Practice contact tracing, explore trustworthy news sources, practicing managing, and how do you cope with anxiety and stress? Like I said, it doesn't just impact your body, it's impacting your mind. Explore how far water droplets can go through the air using the activity with the bowl and the water. We want them to investigate materials that will actually limit the movement of those droplets, experiment with properties of soap, and we want them to communicate with the household to make a plan if somebody gets sick. And again, this whole experience is all about student agency. So we have a number of experts from the field. We have, Dr. Banzal, we have Cassie Morgan, we have Dr. Bigdelli, we have a number of others. And I just wanted to say, through the journey that the youth take from tasks 1 to task 7, it is absolutely enlightening to youth as they're going through it to see these quotes from these world-class scientists about their perspectives on this very complex issue. Each one of these scientists, each one of these doctors explore the issue from an economic perspective, an ethical perspective, a social perspective, and they really help you understand that not only are they grappling with the issue from multiple perspectives, they think everybody, including the youth who are in very rural communities, to think about this issue from multiple perspectives as well as they develop their action and communication plan. So accessing the materials, we have provided 2 different links here. We have our Global Goals homepage, which you can see right there. That will give you access to the mosquito module, the food module, and our COVID-19 rapid response module. And you can also see there we provided a direct link to the COVID-19 rapid response module. And that is where you will be able to access not just the English version, but every single one of the other languages that are currently available or will be available in the next week or 2. And I will say that as quickly as possible, we're coordinating with the World Health Organization. As they are turning over the languages to us, we're converting them and making them readily available. So here's some frequently asked questions that we get on the rapid response module. So what ages is this designed for? We have designed the mosquito module, the food module, and this COVID-19 module to be easily accessible and for students or youth between the ages of 8 and 17. Question 2, how long will it take to implement? This obviously depends on how much time you have available, but our aim was for this to be a rapid delivery, something youth can do in their own homes. And we're hoping that this could be achievable within a week. If you actually can only do maybe a half of a task in a given day. It might take up to 10 days, but the aim here is that it is manageable for youth to do on their own and is something that they can get an immediate impact on. And I think the second question I kind of answered with that first part, do young people need to work with other people on this? Again, the idea is that they should be able to do it on their own. And I think it's important that they can coordinate efforts with their parents or caregivers. The question number 4, can children do this at home? Absolutely. We understand that a lot of people are in different kind of phases of quarantine. And I think it's important that youth are able to do this at home, working with family, maybe working with people in their own home. And there's a big intergenerational appeal to this model, because we know that there are multiple generations living in some homes right now. We want people to be able to achieve the goals of this module in their own home. Do I have to pay to use it? No. Our Global Goals modules and the COVID-19 module are completely free. They are freely available. We want you to be able to download them and use them in ways that you see fit. We want you to curate your own experiences. And we know, as Marc mentioned earlier, we know this is going to be a living and breathing document. This is our first effort to get you to this information in a timely fashion, but we know it will go through changes as time goes on, and we want to work with you on that process. 4, why doesn't it look like the other Smithsonian Science for Global Goals modules? The mosquito and food modules are incredible experiences, but they do take a fair amount of time. We wanted this to be a rapid response, something that youth could do, again, in a timely fashion so that they could see the results immediately, because we know that COVID-19 is spreading quickly. And lastly, what if it is not available in my language? If it's not available in your language right now, we have contact information presented at the end of this presentation. Please email us, and we would like to work with you on that to see if maybe you could identify translators in your local country or region. And again, we want to work with you, and as quickly as possible, we will get this translated and up on our website and available for everybody.
Wonderful. Thank you, Brian. So as you can see, we've listed out several of the questions that we get regularly here. If you have other questions, I encourage you to put them into the Q&A section, and we will address them in a few minutes during our question and answer section. Hold on one second. There we go. So this is me. I'm Katherine. I'm the one who's been popping up throughout this presentation, but I'm our program manager for leadership development and international programs, which means that it is my job and responsibility to work to disseminate this material. So if you have questions about using this material or how you gain access to it, you can always email me. My email is here. We'll also have it up at the end of the presentation. So when we're talking about Smithsonian Science for Global Goals and all of our programs, we don't pretend to understand the complexities or specific needs of regions and communities around the world. But we were thinking about some of the possible avenues for dissemination of this material. So as you can see from this slide, we've thought both about different access levels to technology, and then different levels of, as Brian said, that quarantine that we have all been experiencing. So if you're thinking about communities that are in school or out of school or have different access to technical resources, I think that this slide is at least a starting point to start kind of thinking about some of the different ways to disseminate. And I will just walk through a couple of these. So if you're in a high-tech resource environment and you're thinking about how you want to use this with young people, it can absolutely be integrated into a local learning platform or learning management system. We also have included additional resources throughout the module, which are often kind of tech-heavy extensions. So there are simulations, there are videos that can be integrated. It can also be a great opportunity to engage a group of young people collaboratively. If you are currently out of school and you have the means to engage young people digitally across their different spaces, this is a great way to use this material that not only helps them to understand that intergenerational approach within their home, but also helps them to connect to their peers at the same time. In low-tech areas, students can be provided with a copy of this material printed, or it can also be broadcast over radio or television. And there's lots of different ways to disseminate these modules through bits and pieces sent out as SMS. And I'm sure that there are lots of other great ideas coming out of the group, maybe even in the chat box, about some of the different ways that we can do this in different areas. And then in no-tech areas, if school is in session, this can be done as a whole class or even whole school initiative, which is something that we've seen with our previous Global Goals modules as well. Educators can provide verbal instructions to students. And if students are currently out of school, working at home with their families, working to stay engaged in low and no-tech environments, this can be also disseminated in a paper copy given to students and their families. So in terms of data collection, because we are very keen to see how this rapid response module is used and how different groups are disseminating it. Starting next week, we'll have a form available on our website, the same COVID-19 landing page that we've been referring to throughout this presentation, that will start to collect some of that information. It's not mandatory to fill out this form, but we strongly encourage it. One of the only ways that we can keep doing this work is by proving that it works and proving that it is supporting students and communities around the world. So if you do end up disseminating the COVID-19 module, we hope that you will fill out this form. I will be sending all of this information out in an email as well after today's presentation. The other way that you can share some of what is happening with our organization is to send photos, videos, or written testimonials to me via email. Again, my email is right there. And the third way is engaging through social media, the way that has the avenue that suddenly has become crucial in all of our lives. So you can find us on Facebook, Twitter, or Instagram. On Facebook, we're at Smithsonian Science Education Center. On Twitter and Instagram, we're at Smithsonian Sci. And the hashtag that we're using for all of our Smithsonian Science for Global Goals materials is hashtag SSFGG, Smithsonian Science for Global Goals. And in terms of upcoming opportunities to continue to engage with this material, this webinar will be archived on that COVID-19 webpage as a way for you to kind of revisit and further kind of digest all of this information we've provided. And we will also be hosting an additional webinar next week, Wednesday, May 27th. I believe we're doing it at the same time. And this will offer a step-by-step walkthrough of the COVID-19 materials. So if you plan to implement this material with young people that you're working with, whether that's your own children or young people in your community, that will be a great opportunity to actually dig into what this resource is like. We'll feature some of the developers of the COVID-19 module and will be a deeper dive. Also, if there are educators who you are working with in your community that would like to be a part of that webinar, we strongly encourage them to attend as well. And we will be sending out an email, I believe tomorrow, advertising that. And then finally, if you are looking for a more kind of personalized or targeted walkthrough of the material, that might incorporate ways that you can use this in your specific context, you can email me and we can work together to create a training program that will work for educators that you are working with. All right, so we have gotten to our all-important Q&A session. And I am going to invite all the panelists to come back on camera and join me, and we will see what we've got going on in our Q&A. Carol, Brian, or Mark, do any of you have anything that you would like to add to what we've already presented today?
Yeah, this is Carol. The only thing that I would add is that I want to echo the fact that this project is only as successful as its implementation. And so while for the past 9 weeks, Mark and Brian and their teams have been deeply entrenched in the development of the content and its technical review, as well as its translation, it will only make a difference with youth if it's implemented. And I cannot tell you how important of a role all of you will play in helping to ensure that this content is brought to youth and that they have an opportunity to, as Brian so eloquently noted, investigate firsthand and discover the answers to these scientific ideas for themselves. It's one thing for students to be told to stand 6 feet away, or to wash their hands for 40 seconds, or to wear a mask. But it's another for them to discover the science and the social science on their own. And with your help, I think we can do that. So we really appreciate the fact that you're here.
Great, thank you, Carol. It looks like we have someone with their hand up, Lucia Milson. I am going to invite you to ask your question.
I would like to say, is it safe to open schools, and if so, why?
Is it safe to open schools, and if so, why?
So Katherine, do you want us to try to take that response, or?
Yeah, that's a great question. Mark, do you feel comfortable answering that question?
Oh, he's on mute.
Yeah, okay. No, that's a very important question, and it depends on your local situation. For example, I'm living here in Switzerland, in Geneva, and I know that schools are opening up again, also in some other European countries, but it really depends on your local situation. I also would like to add that you should have a look at this package yourself. And if you have a family with children in that age, just do it yourself. It's really fun. I really enjoyed doing it myself. I was quite surprised by some things I learned even myself. And I thought, this is fantastic. Such a great development. So please have a look and use it.
Thank you, Mark. All right, we've got a few questions in the Q&A section. Brian, I think this one's for you. Are there requirements that students will have specific materials to complete the tasks?
Can you see me?
Yes.
Okay. So I think that's a fantastic question. Just so everybody knows, when we were designing this experience, our aim was that this was going to only require limited or low levels of resources. So every single task is only asking that you have, potentially, for the one activity about soap, we are asking you to potentially use water, cooking oil, butter, or ghee. And when we felt like there might be a constraint from a material standpoint, we tried to provide a couple of options. So really, really, really minimal impact on the amount of materials. Again, the activity with the water, it's just a bowl and water, and you have to find a wall. And I think one of the ideas here was that it's just easily accessible. Youth can do this on their own. And when I say youth can do it on their own, not just the activities, but just almost collecting those materials for themselves. And so I think, to the best of our ability, we tried to make sure the material expectations were very, very low, so that, again, it was easily accessible for all.
Great, thank you, Brian. All right, we've got another question here. Carol, I think this one's for you. Is there a current plan to make the COVID-19 module a more long-term and collaborative implementation, similar to the other Smithsonian Science for Global Goals module? And if so, what would that look like?
Yeah, that's a great question. It's interesting. Last January 2019, we had an incubator where we brought together people from the national academies as well as other members of the Smithsonian and scientists from across the country and globe who helped us to think through what modules should we develop, what topics should we cover in the Smithsonian Science for Global Goals project. And one of them was on pandemics. Now, none of us knew at the time, of course, that we would be living through a global pandemic. And I think one of the reasons Dr. Swaminathan contacted me is because we had proposed to develop a pandemics module. And of course, this was the right time to be able to develop initially a rapid response module on that content using COVID-19 as the anchor, because it's crucial that students recognize that these topics are topics that we experience every day. And so, yes, there's a plan to be able to expand with funding, to be able to expand this module into a pandemics module, which addresses many more of the issues, for example, zoonotic transmission, so transmission from animals to humans, or humans to animals even. That's not addressed in this module, but there's other science that can be addressed in the pandemics module. So yes.
Great, thank you so much, Carol. All right, and some of the questions that have come up over and over again in the chat box include how do we work to translate this into other languages? You, of course, can email any or all of us, and we can work with you to brainstorm some different ways that we can translate it into your local language. I also see a couple of questions about if there will be a recording of this webinar. Yes, there will be. It will be hosted on that COVID-19 webpage. Let's see, are there any others here that we can ask? All right. Are there any plans to make a shortened version that's easier for printing for distribution to areas with low connectivity? Brian or Amy, or Brian or Carol, do you have an answer about that?
Yeah, I mean, the only thing I think we would say is that this is 30 pages. It is very low tech in terms of images. It's divided into 7 tasks. And the hope is that because we've been very minimalistic in terms of the fact that it's simple text and not complex graphics, it should be easily downloaded if it can be and printed in these 30 pages. So we did try to keep it short. Brian?
Yeah, I might also add that one of the things that we've done with the mosquito and food modules is to break up each individual task into its own PDF so you can download and print it easier. And right now, this rapid response module is one complete document. And if there was a lot of interest and questions like that, what we could do is just provide each task as its own PDF so that you could then maybe select the task that you would like to print off, and it would just be less of an impact on the printing.
And then Katherine, I think a couple of these other questions fairly quickly before we lose time.
Absolutely. We'll take one more question.
Okay.
So from Maria here, presently there's a shift to home-based learning, so our instructions provided for parents so that they may use this at home.
Yeah, well, this was designed, Maria, to specifically be for home use. So while the Global Goals Project is normally with the idea of students being in classrooms, given the fact that at the time of its writing, 90% of students were learning at home, and many of them still are, this was specifically designed for home use.
And I'll also add that the letter in the front of the rapid response module by Carol really helps parents and caregivers understand the intent. And as youth go through the experience, it's meant to be something you could do with your child.
Yes.
It's open-ended. There's no answer key. and we want you to explore these issues together if possible.
Yes. And to Dion's question, you know, the fact that we have integrated social and emotional learning supports, emotional supports throughout the module, because Dion's point that these activities will have an impact. COVID-19 in general has an impact on youth, and we have been very concerned about that and very clearly addressing the need for emotional support throughout.
All right. And it looks like we've got a couple of other questions in the chat box, or in the question and answer box, which we're going to try and answer here in the next couple of minutes with typed answers while we wrap up. But in the interest of time, I will turn it over to Carol to kind of give us some final words today.
Yes, so we want to thank, obviously, our colleagues at the InterAcademy. We want to thank our colleagues at the InterAcademy Partnership, our colleagues at the Smithsonian, the World Health Organization, all of whom helped us to develop this module. But we would not have been able to do this without the support of the Gordon and Betty Moore Foundation. And so we want to thank our colleague Janet Coffey at the Gordon and Betty Moore Foundation and others who've provided their support of this project. And Katherine, I have to jump off, but I was wondering, will the other questions be answered as well?
Yes, we're answering them. We're typing answers to them as we speak.
Okay, thank you so much.
Yeah, absolutely. So to wrap us up today, we really hope that you all will join us in this effort. We believe that COVID-19 and our response to it as an organization, as communities, and as a population of humans is one of the most important things that we will do in our lifetimes. And that supporting young people to do this and giving them the tools, the knowledge, and the opportunity to take action is incredibly important. So thank you all so much for joining us today. And especially thank you to Marc Sprenger from the World Health Organization, who has taken the time out of his afternoon to join us here on this webinar. I will leave up these emails for Carol, Brian, and myself. And if you have additional questions or would like additional information, you're welcome to reach out to us. So thank you again for joining us, and I appreciate your patience for running over your time by 4 minutes. And I'll hang on and make sure we get these last few questions answered here in the Q&A box. But thank you all for attending today, and I hope that you'll join us next week for our next webinar.